Hello, everyone. Welcome back to InnoHealth Magazine podcast, where we chat with the heroes making waves in healthcare. Today, we have got a real superstar joining us, Captain Indira Rani. Her career has been all over the map, from top notch military hospital to teaching gigs at AFMC, Escorts Heart Institute, and Medanta Medicity. Captain Rani's leadership is top tier, covering every aspect of nursing and healthcare. She's all about pushing boundaries and getting the best for patients. Whether it's starting up a new hospital or rallying teams around a common goal, she has done it all and aced it. And let's not forget her academic chops. She's currently diving into a PhD in health economics, adding to her already impressive list of achievements. Sticking around as we dive into Captain Indira Rani's incredible journey, a journey marked by her unwavering commitment to excellence and her impact to the future healthcare. Welcome to the podcast, ma'am. How was your day?
Yeah, thank you, Vaishnavi, and thank you for the nice words you have told about me. And day was hectic, as you know. The hospital is bubbling with a lot of energies and daily troubles we face it in giving care to the patient. So every day it's a challenge for the administrator. So it's a hectic day for me today.
Okay. We'll just finish this up soon so that you can have a pleasant night. To begin with, I would just like to ask you that I have also been into hospital industry for quite some time now. I have been seeing quite a disproportion between the male and female staff, especially in the nursing field. So, what would be your addressal to it?
Okay, the male nursing and the female nursing proportions in the staffing, am I right?
Yes.
Okay. This male nursing has started into the nursing, males have started into the nursing profession somewhere in 1990s, late 80s it is. That time, in fact, I was doing my master's and we had a lot of debates in the master's debating sessions, how male nursing is going to contribute and change the scenario of healthcare.
Hmm.
Okay, so that was a big debatable topic for us as students that time. Now, after almost 30 years, I'm doing on again the male nursing. So it's very quite interesting after experience having male nurses in the system.
Hmm.
Okay, you're right. We have the proportions are not equally distributed in the staffing ratio in the hospitals. The reason being, as in nurse administrator, I tell you, the way the woman, the nurse, the female nurse delivers the care with a lot of compassion and empathy, and that we don't find from the male nursing. One is that they're technically very good. They grasp the technical skills very good. They're very good in handling the equipments. And some of them are very good as an administrators, as a team leaders. But when you give the care, that care and the female nurse who really involves in the patient, like a empathetic feeling while giving the care, and males mostly, not all of them, most of them are very mechanical in whether you change the a tube or you feed a patient. So that part of touch is lacking in the male nursing, and most of the males are not inclined towards the clinical practice or bedside nursing. They quickly want to turn into physician assistants or a technical job or administrative job. They most of them are interested than doing a bedside care. So most of the hospitals, at least in Delhi, we have less number of male nurses into the profession, and some of the hospitals they don't even take them. They mostly absorb them in the administrative roles.
Okay, we have also read that you have been a very instrumental member in commissioning new hospital. So how do you? What are your key strategies for ensuring the integration of nursing services into these new hospitals? Like, how do you do it?
Okay, so I had an experience of starting up a new training programs for the nurses and escorts after I left my army service, and slowly I moved into commissioning of a hospital. That is, I was one of the active participant in commissioning of Medanta Medicity, which we started 6 months before. recruiting the nursing, the young nurses in the field, and training them for 6 months almost, preparing them for commissioning of the hospital. And once you in the construction itself, when the basic structure is over, then how do you plan a ward? How do you plan a critical care area? Where are the nursing stations should be there? And what are the like entire complete hospital planning for patients, which is really a commendable job for me. And I did it in Jaypee Hospital, where presently I'm working as a chief nursing. Then nurses, like I have seen it from the what is that from the map of that from the drawings onwards. I remember where the bed should be put, where are the points to be put, which are the points for the ventilatory supports, what are the corridors to be put, how much to be there. So every time I used to be on, most of the times I used to be on the table to discuss with the architects to doing this and talking to the selection of the equipment, mainly with the architects. It was so in fact in the beginning it was like very new to me. Oh my god, how will I do this? But as you do it and you just get into the depth of the opening in hospital, and it opening is not when a building is constructed, but when the drawing itself, the nurse's presence is very, very important, because we are the one who are to handle the entire hospital, especially the patient care services. So I was one of the fortunate nurse, I must say, in India to get into this way of working. Thanks to Dr. Trihan and to Jaypee Hospital, that our founder chairman Gaur Saab and team. They given immense opportunity for me to do this work, and where I remember doing even the map changes, the drawing changes. No, it should not be this. This antenna should be this. So it is a very good experience, and every nurse need to be involved. Every nurse leader need to be involved, and not only the nurse leaders in the senior positions, but even the middle level managers, if required, a staff nurse who's going to look after the patient, need to be involved in the commissioning of a new hospital, how the license has to be bought, what are the various, how your new hospital is done, how you select various equipment. So one of the key role I played is in selection of the equipments, initial bit selection of his team members. Team member doesn't mean that it's only nursing. It is a technician, the supportive staff, even the feedback of the doctors. The nurses are the best ones to give their skill sets. So it is a wonderful experience throughout commissioning of a new hospital, and it is like everywhere you are involved, in a blood bank, in the lab, in selection of shoots for your sample sending. So it's a volumes to speak about commissioning a hospital, and nurses play a very important role in this. So the nurses need to update their knowledge, the administrators, new administration management skills, then update on the equipments, the technologies which comes out. That is very important for a nurse leader to understand, to involve herself in commissioning of a hospital.
Okay, so now that we have seen the parameters that goes into opening an hospital, it is what I could understand, it is majorly around the architecture and the team membering. So, but now we have been speaking about innovation and technology also. So, what has been that one technological adaptation that you have seen during this journey that has been a game changer in the hospital setup?
Okay. The game changer in the hospital setup is the hospital information system, the software we use for various processes in the hospital, whether it is admission till discharge. It is there, the process, which I was, I've seen this in the from escorts when I left army. And in Medicity, we have the updated systems, HIS system. How do you select your modules, and what is the process of admission of a patient, where you need to get the alerts, and how do you take the patient in the bed transfers, how do you do their admission process, how do you put various lab tests, how do you indent the medicines, and calling a consultant. So everything is so well integrated in this hospital information system. That is a big game changer, because how do you indent? There is nothing you miss out in the hospital information systems. And how do you do the billings if there is a similar products, like some of the how much you suppose you ordered some amount of consumables or some pharmacy items, and how much is used, how much use consumption has been done, and what you have done with the rest of the things, how you have uh, returned back to the respective pharmacy, and so that the patient is justified with the billings. Then daily activity sheets and daily transfer in transfer outs of the patient, everything is a, I found it is a huge big game changer for hospital processes, and it is very easy to adapt to. But
Yes.
at the same time, everything of a patient process cannot be under this system software. Like you cannot go 100% paperless. You need to have like but the patient files and some of the records are very essential, especially in India. We did not go 100% on nursing care plans and nursing assessments, because when we have the bandwidth of going, but we don't have materials supplies. Like you have to have a palm tops, or you have to have your iPads, or some system on your hands, so that you can do everything entry on the software. That is not possible so far. I don't know, maybe in the future we may go 100% paperless in the hospital.
So, apart from having the resource lacking, do you also find some other things that are lacking, which is taking us, or maybe there is a friction in the adaptation of technology apart from the lack of resources?
Yeah, one is yes, there is a adaptation to the technology. First is Vaishnavi, we need to have technology to adapt ourselves.
Ah,
And because, yes, we need to adapt ourselves. And another one is the training, the curriculum. When the new graduates pass out, the new nurses comes out of it, how much their curriculum is teaching them to adapt this technology. So you need to have a curriculum which is integrated in this 4 years or of the graduation program, to integrate this technology in the curriculum, so the nurse learns from the day when she enters the school how to integrate with this technology. But here, you don't find this changes in the curriculum. In the nursing curriculum, we have not. Yes, we have certain hours of computer classes, certain hours of like integration to, maybe if you visits to a hospital to see how the software works out, but it is not really integrated. Then if you integrate it, it's easy. You integrate in the curriculum. Do you have a faculty to teach that faculty? Second is that when you take them with the 12th grade, do they have computer skills? Did they
yes.
take computer operations? So it is not stopping at adapting a technology as getting a software in our patient monitoring or caring, implementing in the care systems. But how do you start it? Like an administrator, when the new graduate comes to me, it almost takes 3 months for her to understand how do you handle this HIS, that is hospital information system. It's entirely new for her. How do you enter? How to take it out? So we find a lot of mistakes being done by the nurses. It is not mistake; they've overworked with this
Mm.
trainings, and because it's not been delved into the curriculum from the beginning. So it is a huge challenge for all the across the hospitals. It is not only in India, even the other countries, because if it is not incorporated in the curriculum and you did not have that much skill sets to learn, it will be very difficult for us to take it forward. So we face the challenge, the hospitals here, whether it's a government or a corporate hospital, like how do you train these nurses, how to help them to handle it. For example, one we are talking about HIS, the other one is the robotic surgery. When the
Yes.
robotic surgery comes, the technology is very high in the OT. When a new nurse enters the system, or a nurse with a 2 3 years of OT experience, how she adapts herself to assist a surgeon to the robot. She need to have a technical skill. She has to undergo specialty trainings to handle this. So it is a continuous process of learning. As the technology is evolving, the nurse also need to evolve herself to handle the technology. So training is important, and this is how adaptation, it will not come over time by working in a ward, but how you put her in under various trainings.
So I think platforms like Health Magazine will outline such
Help us.
flyers, where
Absolutely.
we can get, when we talk about patient excellence, we can even have academic excellence. And I think
Yes.
now it is a mandate to have computer science as one of the basic subjects in all the healthcare related subjects, because it is everything is majorly around
Yes.
computers only.
Mhm.
So apart from it, like we have been speaking about HIS now. So what do you feel are the opportunities for the young innovators who are waiting there for bringing more innovations apart from HIS? What else can be brought into the industry which would smoothen the process for the nursing staff?
Very good question. In fact, I keep asking when I meet various companies who comes to me across my table. So, what are we doing? More innovations to help my nurses to monitor the patient properly, or give assist us in giving a best care to my patients. So, and like health or the various innovations which come, how you integrate the technology. We commonly talk of artificial intelligence, which is echoing everywhere now. And in few years' time, this AI is going to take over the hospitals very nicely. And the nurses, how do we adapt? Like first, we many of us done a lot of research on this. The non-nursing duties, the nurses do it
Hmm.
mostly, the non-nursing duties, and which is like maybe intending a medicine or returning something, or maintaining a narcotic drugs, or maintaining certain indents in the in your store, whether it is available or not. And so when you find some of the scientific studies done, like 70 to 80% of the nurses time goes on in monitoring, doing a non-nursing duties. So she has very less time to interact with the patient and the family. So these we require in innovations where like vital signs monitoring a bit, like in critical care area, of course we have a monitors to do it. But in a IPD inpatient areas in the floors, we don't have monitors. The nurse need to go and check it every 2 hourly or 3 hourly, 4 hourly. So in a shift, she goes to a patient to check a vital sign. She need to talk to the patient. So much of thing. So some of the tasks can be taken by a technology which where nurses not required. First, suppose I'll tell you one example. In narcotics, we maintain very important, one of the important, it's a small example I'm giving you. Narcotic drugs maintenance. We have a double check, double registers, and we have so many people to check it and control in each shift. So this system, suppose I take one dose of narcotic and the second dose, third dose. So we have a counted medicines in the cupboard. So when if you put an innovation technique there, I will not say AI or any device where you say yes. Now out of five you have used it two, you have used it three. Now I get an alert. There are only two left. Last 4 days you have already used it. There is a potential use of more of these drugs. So you replenish it. So they may send a message to the put up an indent and goes to the pharmacy, and the pharmacy come and refills it and gives an alert. The same way, some of the like lab test, you have a critical values which you are coming, critical values, which is an alert comes to our mobile. Yes, this patient HB is only, hemoglobin is only 2, or it is only 3, or some platelet count is very low. So you have to do it. Give a prompt like platelet, to inform your doctor and get your platelets ordered. So some of the many things, innovations are required, which help our profession to give a better care. Because as I said in the beginning, many of the tasks because of NABH audits, we need to maintain a lot of records. Everything need to be maintained. So sometimes I wonder these audit systems, these accreditation standards, which are there for better practices, best practices, and for patient safety. So how much we are able to implement. So
Hmm.
we finish audits. So how much we are able to implement in daily? Can a nurse in her 6 hours of shift, she will finish her shift. She sits and writes her records.
Hmm.
So how we are going to? There are a lot of technologies. There are a lot of advancements have come in the world. But how much we have been given the chance to use those technologies and innovations to give a better? Because the nurse is required with the patient and the family and the doctor first. So we are having very less time to spend with the patient. Now, whether it is a counseling part, like when I was a young nurse in army, I used to spend a lot of time talking to my patients, talking
Hmm.
to doctors, discussing about the cases, talking to the families. It's so wonder. I used to wait for the visiting hours to come so that I can interact with the family, give them so much of healthcare advices. But here, uh, When I look at my nurses, they don't have time because they're either putting in the computer some indents, discharging a patient, or doing some other non-nursing duties, or so the time is not there. Time is we spend more less time because one is that we don't have that much manpower. We
Exactly.
the one nurse need to look after at least 8 to 10 patients, 12 patients, sometimes 15 patients. So she doesn't have time. Most of her time goes on giving medications, taking rounds, intending medicines, discharging patients. So lot of things. There is n number innovations which are suppose an IV in a closed. Now we have single rooms, deluxe rooms, double bed. Now one patient gets an IV infusion in one of the closed door. So how the nurse every time she runs to the this thing, though she sets the in with the her syringe pump, she goes and checks it. Or the patient electrodes presses the bell. She has to run and see the infusion is getting over. She's busy with another patient. It delays for her. Then patient's IV is finished. So a lot of things. So I remember one of the student in one of the university in Noida. They came to us. He was a 12th standard student like 5 years back. He innovated one device where it is connected to the IV set. When the IV is getting over like 20 ml, 25 ml, that message comes to the counter. The nurse who has started, the alert comes to a mobile. So that was a wonderful innovation. So we require a lot of innovations to Vaishnavi to do our patient care in an excellent way.
So when you spoke about narcotics drugs, I mean, addressing to replenishment, it would even address to overconsumption, or maybe
Absolutely. Yeah.
keep a monitor that it is not used or misused by any means. So
Yes.
yes, we need a number of technologies. I think
Technologies.
having a transcriber who can convert the verbal conversation into written would lessen the load
Absolutely.
of documentation.
Mhm.
And I think to some extent the accreditations, I think they do a lot of paperwork. So
Yes.
you
Much
have
of
to do
paperwork.
some that needs to be addressed too.
Addressed.
Uh, so you have been in the nursing leadership now. Also, what have been some of the pressing challenges that you have faced during the nursing leadership part of your journey?
Okay. See, before I tell you the nurses' challenges, there is every day there is a challenge. Like we started a hectic day, there's a new challenge, new patient complaint, new administrative complaint, something. So every day is a new thing for us. Some of the challenges I faced is that attrition of the nursing in nursing department, attrition of the nursing because you train certain group of nurses, and there is a very quick attrition. At least every hospital in Delhi NCR and most of the hospitals, corporate hospitals, they face this because of the main thing I should say is that somehow there are two things. I will not say always it is the monetary, it is the financial reasons. It is a nurse who comes to us, like 3 months. First, these 6 months are very very important for us to adapt to this, the infrastructure, the technological advancements, the writing, up to your audit, the standards, accreditation standards, patient safety, communication. There are a lot of things the nurse need to completely transform ourselves to work in a private setup. How do you take rounds with your doctors, your team communication, your team dynamics? It is everything is new for her when she enters. It is like a new world for a novice nurse who comes. So these nurses, to making them to a novice to an expert nurse is a big challenge for me. But I'm very proud to say that most of the nurses pick up very good skills in 6 months, like especially in the critical care areas. They do wonderfully because the Indian nurses are very young. Am I right? The young nurses who come to the profession at 20, 21, 22 year is the one girl who comes to me 21. So easy for me to, adapt for them, mold them. They're like raw material. So the nurse leader need to have that knowledge and ability. How do you create young leaders? How do you create young leaders? At the same time, she has a very difficult task of it is. I will not say it is difficult for me. It is an enjoyable after working in Jaypee Healthcare for a long time. Um, is how she manages her boardroom persons, like bedside to boardroom. So how you make yourself stand in the boardroom, discuss your nursing issues, and I don't say again nursing issues. How do the budget, the business development skills? The nurse, nowhere she is like with the patient. She is involved with the business development skills. Give them ideas. This is the way how you develop your business, how you put your international patients. We have a lot of internationals, and how do you handle your domestic this thing? What is the revenues from each department where you have a revenue loss? Because Vaishni, if you say I'm completing my PhD in health economics, as it is 7 years, I could not, I mean, I'm still doing it. So what I would like to tell you is that the economics involved in patient care is very, very important for the bedside nurses to prevent the not to maintain a standard or maintain a right bills to the patient. She need
Hmm.
to have understanding of the health and economic. This one of the challenge I have faced here, and various insurance system, how a TPA, third party insurance works, what are the various panel patient, what are the type of patient comes, because each patient you have a different way of billing, different way of intending. So these are the few challenges I face as an administrator when related to the hospital operations, when budget allocation, how much budget has been allocated. Every time we get like, compare all hospitals and what is the pay scales of the nurses. Every 3 months, 6 months, our pay scales get. How do you retain the staff? By increasing their salaries. So how
Hmm.
do you make your working environment be an enjoyable environment so that the nurse stays there? That is giving her training hours during the duty hours. Don't call her beyond her working hours. Give them the maternity leaves. A nurse who is due for her maternity leave, give her a lighter areas. A nurse who cannot do her 3 shifts, give her a, how compassionate the nurse leader. One is the finances, then a second is how compassionate the nurse leader, and make their other middle level managers compassionate so that we can look after the nurses very well. At the
Hmm.
same time, mending and coordinating and collaborating with your top leadership and other departments is very, very essential. For this, I feel the nurse leader need to be very strong, and she herself need to have that cool personality and a stable personality where she can understand and solve the problems.
Hmm.
So this is it comes. She need to be a dynamic person. It is not dealing with a person like me in a handling the like a department in JP Healthcare right now. You just cannot be with your department. You when you come to a senior leadership, you have to be a part of every department of the hospital. Every department, how do you handle and slowly get them to our nursing standards and help them and get it done. So it is an enjoyable at my level at least. I really enjoy and creating a nurse leaders. If a nurse is doing very well, in young leader with 2 years, 3 years, I have a ward in charges with 4 years of experience. 5 years of experience, because how she had her personality to manage an in charge level. So that is what we need to look into. It is not like blindly 10 years of experience. Those standards have gone. It is your performance, you do well. Your patient doctor is wanted the particular nurse to take rounds. The patient wanted a particular nurse. She is my in charge. She is my best nurse.
Okay, I'm sure with the excellence of the knowledge of the industry that you have, you will make such a leadership implementation that will surely have good nursing staffs in our industry. So, as we are coming down to summarizing our session, I would just like to ask you that what would be your advice to the young minds who are going to enter the nursing industry? What all things they should focus on, and what should they aspire for coming forward in the journey?
Good, very good question. This is my daily talk to my nurses, almost the new nurses. First thing I want to tell, don't get scared of the profession. It is the most loving, most noble and enjoyable profession. You will never be without a job if you're a nurse.
Exactly.
Anywhere you will get job. Anywhere you go inside a hospital, you are being absorbed. Update your knowledge,
Hmm.
have a excellent clinical skills. Nurse with a clinical, and now I will add a technological skill, because the artificial intelligence we have to tomorrow we have to work with them. So the clinical skills, the technological skills are the weapon for a nurse to have a patient safety,
Mm.
Very excellent care. Your excellence is only with your clinical skills and up-to-date knowledge and your technological skills. These are the three parts, but which is all depends on your how your attitude and aptitude. That is another two words which are very, very important for the nurse. If the nurse, because we deal with the human beings directly, we don't deal. The machines are our support system.
Mm.
The machines are our like some tool to do something, but we have our hands, our caring mind, our caring words, which is most important for the nurses to don't leave the essence of nursing. You go ahead with the nursing profession, but you update your knowledge, have your technical skills, have your the team dynamics, to change your attitudes and just fly. There's nothing in us. Nobody can stop a nurse to reach after this guy. Somebody asked me, ma'am, you're doing PhD after this. I said, Arey, I'm finishing my PhD. I'm thinking, what should I do later? How will I put my postdoctoral program? What I can do for my nursing profession? So there's nothing to get scared. You're a nurse. Maybe previous years, the nurse maybe looked down in the society, in Indian society, because of whatever, maybe the reasons all of us know about it. And what I want to tell you is now the stand-alone profession is the nursing and the medical profession. The nurse, as I said, update your knowledge and have a strong willingness to go ahead. You will be the nurses. We are going to the planet wherever we are going first in the NASA, wherever we going to have another planet. So we are one of the ones to go to look after those people who reach there. So there's nothing to get scared. Just be confident. Be adapt yourself with a good personality. I will not say good personality, with your attitude and aptitude towards adopting the technological advancement in the patient care.
Mm. Okay, so thank you so much, ma'am, for sparing out your time for us. And I think through this podcast, it would be a great message for everybody regarding academic excellence that we could have in the industry, the innovations that we can have in the industry. Then, yes, the young minds who get usually very disoriented that where should they go and what should they do. I think this podcast would be very helpful for them. And I think you had a great time speaking to us.
Yeah,
And look forward to have more such sessions with the excellent ideas that you could bring on the table, and we can take that forward. So thank you so much, ma'am.
thank you, Vaishnavi. It's a lovely discussion with you, and I'm happy if it reaches the nurses across. And there's nothing challenging nurses. We are the best profession. And at that end of 35, 37 years of my service, I'm so proud to be a nurse.
Mhm.
Thank you so much.
That's great to hear. So that was me, Dr. Vaishnavi, in conversation with Captain Indira